physiotherapies help a woman who has gone through vaginal delivery?
Yeah. Okay, so vaginal delivery can often leave a painful perineum, which is basically healing from. I usually explain to people it's a bit like having a sprained ankle, where you get swelling, heat in the tissues, you can get bruising, and where women have had a tear, a natural tear, or an episiotomy, where the doctor actually has to cut through the tissue, which is between the vagina and the anus in the perineal area. They often need stitches, and that is a bit like, really like an injury. So you are trying to let, first of all, things heal. So the initial steps are so important, in terms of applying ice, just like you would to a injured ankle, which is very swollen. So you'd want to apply ice with care. So something sterile. I usually advise people to use a surgical glove, and they fill it up with some crushed ice, and they give it a little knot, and they just gently apply to that swollen area in the perineum. If a woman immediately postnatal is going to have to empty their bowels to have a poo, it's often very scary. So what I advise people to do is, the first time that they sit there, is with either a piece of tissue or a pad to support the perineum, that area that has had stitches, as they open their bowels. It's a lot less scary to give some support. And then the issue of having sex. Once everything has healed, normally doctors, women who have had an episiotomy or a natural tear, usually the advice is anything at around 6 weeks to return to sex. However, saying that, some women are completely fine between 4 to 6 weeks, and so that needs a little bit of individual. It's not a blanket guideline and advice on that. So if you're feeling ready by 4 weeks and you want to try, there's no reason why not to. Now, the main thing is being prepared and seeing how you feel, taking it very easy, and I'm sure Dr. Martha Lee can give more advice on approaching that side of things, how to prepare well for having sex the first time after having had a baby. However, if there is pain, and there is persistent pain that doesn't get better after 2 or 3 tries, it is important not to just grind your teeth and get through it, because that can lead to problems later on. So if there is pain on initial sexual contact, then come and find somebody like myself who can talk you through how to improve that. And there are many ways of doing it. One is making sure that the pelvic floor is not in a constant state of tension, so learning how to relax. Or if it is very weak and it has a lot of scar, then maybe we need to work on releasing that scar tissue, just like we would do on any other part of the body, like skin or muscle that is very tight. We can do very gentle massage around the scar following an episiotomy. If the muscles are very weak and there's no sensation having sex, then that's when we work with strengthening, and so together with an ultrasound machine or with internal feedback, I can design an individualized program for you to get your pelvic floor to where it needs to be. Okay.